Welcome to Medicine's Greatest Hits, and let's get straight to the point. Point number 8, inserting radium rods into children's noses. Imagine you're a kid in the 1940s with a stuffy nose, and instead of getting decongestant, a doctor decides to shove radioactive metal rods up your nostrils. You're sitting there crying while they're threading glowing sticks of cancer directly into your face holes, like decorating a tiny, terrified Christmas tree. Here's the twist. This was standard military protocol. The US military genuinely believed nuking children's adenoids with radium was brilliant preventive medicine. Thousands of kids got this between the 1940s and early 1960s. The official term was nasopharyngeal irradiation, fancy speak for let's turn a child's skull into a miniature Chernobyl. Think of it like using a nuclear blowtorch to fix a leaky faucet. They pointed a radiation cannon at the most sensitive tissues in a child's head. Kids who got this treatment had significantly elevated rates of thyroid tumors, because apparently swollen adenoids should include a side order of cancer. If you were a military kid in the 1950s with ear problems, your parents thought they were getting you top-tier healthcare. Instead, you got a dose requiring its own hazmat team to clean up. From an evolutionary standpoint, adenoids fight infections. It's a feature. But post-WI military medicine decided, you know what would fix this? Weapons-grade radioactive material. By the time they stopped, an estimated 500,000 to 2.5 million people had been treated. Nothing says cutting-edge medicine quite like needing a 50-year follow-up to count all the tumors. Point number 7, freezing experiments on mental patients. You're in a psychiatric hospital dealing with depression, and your doctor's revolutionary treatment is to literally turn you into a human popsicle. Full-body ice baths, sometimes for hours while you're conscious and begging them to stop. Major psychiatric institutions used refrigeration therapy as standard treatment well into the 1960s. Patients would be submerged in ice water until their body temperature dropped to around 90 degrees Fahrenheit, often kept there for days. Psychiatrists genuinely believed inducing near-death levels of cold could reset brain chemistry. Some patients were kept frozen for weeks, repeatedly cooled and warmed in cycles. Imagine your landlord deciding the broken heating is good for your mental health and locking you inside. That's what this was. Except the landlord had a medical degree. Patients developed frostbite, pneumonia, and sometimes died. From a survival perspective, the human body has sophisticated temperature mechanisms. This practice wasn't abandoned until the late 1960s, mainly because patients kept dying and hospitals got tired of lawsuits. Point number 6. The monkey drug trial's human version. You're a prisoner and a researcher offers you a deal. Participate in a study for time off your sentence. What they don't explain is that the study involves giving you massive doses of LSD to see how long before you completely lose your mind. This was perfectly legal and CIA funded. Programs like MKULTRA gave prisoners and soldiers drugs, often without consent, to study interrogation techniques. Some subjects received doses hundreds of times stronger than recreational amounts. If you were in prison for something minor in the 1960s, you might have been offered experimental medication. Congratulations, you were testing whether the government could develop a truth serum. From an evolutionary standpoint, human consciousness evolved to process reality. These researchers flooded it with chemicals designed to shatter perception, then wondered why people never recovered. Most records were destroyed, so we'll never know how many minds were systematically dismantled for national security. Point number 5, electroshock therapy on children. Imagine you're 6 years old and wet the bed, and your parents' solution, recommended by doctors, is to strap you to a table and run electrical current through your brain until you have a seizure. No anesthesia, just raw electricity. From the 1940s through 1970s, children as young as 3 received electroconvulsive therapy, also called ECT, which is for hyperactivity, bedwetting, or being difficult. Some kids got hundreds of treatments. Early ECT involved no muscle relaxants, nothing to prevent violent convulsions that could break bones. Doctors would send 70 to 150 volts through a developing brain to induce seizures. Your parents think you're too energetic, so instead of letting you play outside, they take you to a doctor who says, "Have we tried frying their brain?" Children would wake up confused with memory loss. Some developed permanent cognitive impairments. If you were diagnosed with childhood schizophrenia in the 1950s, often just autism or ADHD, you probably got ECT. What you got was a series of seizures that made your memories disappear. Point number 4. Radiation experiments on pregnant women. You're pregnant in the 1950s, and your doctor offers you a new vitamin supplement for your baby. Except that vitamin is radioactive iron, and you've just been enrolled in a study to see how radiation affects fetal development. Multiple universities conducted radiation experiments on pregnant women, often without informed consent, from the 1940s through 1970s. At Vanderbilt University alone, over 800 pregnant women were given radioactive iron between 1945 and 1949. Think of pregnancy like building a house. These researchers said, what if some of these bricks were slightly explosive? Follow-up studies found a 40% increase in cancer mortality among offspring. If you were low-income or minority, you were at especially high risk. These programs targeted vulnerable populations who wouldn't ask questions. You came in for prenatal care and left as an unwitting radiation experiment. From an evolutionary standpoint, the placenta protects the fetus. These researchers thought, but what if we just put radioactive material on both sides? Many women were never told they'd been given radioactive substances until decades later, if at all. Point number 3. Military chemical weapons testing on soldiers. You've enlisted to serve your country, and your commanding officer orders you to a routine exercise. They put you in a sealed chamber and start pumping in mustard gas to see how long you last. You can't refuse. It's a direct order. This was standard practice from WI through the 1970s. Tens of thousands of service members were deliberately exposed to chemical warfare agents. Programs had names like Project 112. The reality was chambers full of soldiers exposed to VX nerve gas, sarin, and mustard gas. Think of it like your employer setting a real fire and locking employees inside to see how long they survive. If you were a young enlistee in the 1960s, especially if you were Black or Hispanic, you were statistically more likely to be selected. The military deliberately sought minority soldiers for the most dangerous exposures. These programs ran for decades and were only exposed when journalists forced declassification. Many records were lost, and thousands of veterans struggled to get recognition because the military insisted the tests were safe. Point number 2. Prison medical experiments. You're in prison for a bad check. A researcher offers you a few dollars for a medical study. Sounds reasonable until you find out it involves infecting you with diseases or testing experimental drugs with unknown side effects. From the 1950s through 1970s, American prisons were human testing facilities. At Holmesburg Prison, over 100 inmates were exposed to dioxin Agent Orange's active ingredient, infectious diseases, and radioactive isotopes. Some had their entire backs covered in patches of experimental substances. Researchers paid prisoners pennies per day. Imagine being offered $10 and extra dessert to let them inject you with a drug that might cause liver failure. It's like being offered a coupon to beta test a parachute. If you were at Stateville Penitentiary in the 1940s, you were probably part of malaria experiments where researchers deliberately infected hundreds of prisoners to test drugs. These experiments continued until the mid-1970s, stopping only after investigative journalism exposed them. Point number 1. Insulin shock therapy. Imagine you're depressed after a breakup, and instead of therapy, your doctor injects you with enough insulin to send your blood sugar crashing into a coma with violent seizures, if you survive. And many didn't. They wake you up with glucose and call it treatment. They'll do this multiple times a week for months. Insulin shock therapy was the gold standard for schizophrenia from the 1930s through 1960s. Tens of thousands of patients were subjected to this. Psychiatrists would inject massive insulin doses, deliberately inducing hypoglycemic comas. Patients would convulse, brains starved of glucose, sometimes for hours. Think of your brain like a computer that needs constant power. Insulin shock therapy was like unplugging it while running, letting it shut down, maybe letting it overheat and damage circuits, then plugging it back in to see if it still works. Sometimes it came back with corrupted files. Permanent brain damage, memory loss. By the time it was phased out, an estimated 100,000 plus patients had been subjected to it worldwide. Many were left with lasting cognitive impairments and psychological trauma from repeatedly being brought to the edge of death as treatment. Nothing says modern medicine quite like inducing comas in mentally ill people and hoping their brains would work better, while not mentioning the ones who never woke up. If any of this made you uncomfortable, imagine how the people who lived through it felt. Except they didn't get to click away.